All right, guys, welcome to week 11. This is going to be your principles of growth and development and principles of growth and development 28 days to 1 year old. So we're going to start with principles of growth and development. So we do see that when we talk about growth and development, we are referring to the total growth of that child from the time they're born up until the time they're considered mature. The definition of growth is the physical increase that we see in the body's size and the appearance that is basically caused because of the increasing numbers of new cells that the body is making. The development is the progressive change that we see that occurs in that child towards maturity or maturation, which will then complete their growth and development. The growth of the child does usually follow an orderly pattern. It starts with the head and then it moves downwards, which is referred to as cephalocaudal. And growth also proceeds in a pattern referred to as proximodistal, in which is the definition that growth will start in the center and it will progress towards the periphery or the outside. And if you look in your book, there's a great picture that shows you exactly just that, the ways that we see the child grow. So when we talk about growth and development, it's very important for you guys to keep in mind that every child, every baby has their own very unique pattern of growth. These patterns that we see related to their height and their weight, we want to make sure that we're monitoring them and recognizing any type of deviation from their normal pattern, because this is how we will be able to identify potential medical issues or any type of concerns regarding the child. So when we talk about height, as the child begins to grow, the height or that distance from the head to the feet is going to increase in what we consider a predictable pattern. Increases in height will prove that that child is growing the way that they should be. The length of the infant and the increasing height of the child are going to be measured routinely. As we take these measurements, when the children come into the pediatrician's office, these patterns are usually monitored and then plotted on a growth chart and compared to other children in that percentile. It tells us where that child is and how they're growing and is there any issues. So we look at their height, we also look at their weight. So weight gain is also a sign of that their weight is progressing, that they're growing. There is a lot of different reasons why there can be a variation in the weight of one child compared to another that are the same age. But weight gain is an important factor in the growth of every child. Just like we talked about with the height, patterns of weight increases are going to be monitored and they're also plotted on charts. Growth charts and developmental assessment tools that we find in pediatricians' offices and in the hospitals are used to compare the child's growth that you're measuring at that time to other children of the same age and the same sex to determine if that child that you're measuring at that point in time is above or below that standard, what we consider that standardized normal range. Now, children can be above the standardized normal range or below and still not have any type of issues. There might not be anything wrong. That's just where they fall. But we do use these as measurements, and it kind of keeps us looking out to make sure that there's no problems. Growth charts, like I said, we do use them, but they are only used for comparison only. So if they don't fall into that normal range, it doesn't necessarily mean that there's anything to be concerned about. It's just a comparison. We do know that the genetic makeup of every child is going to be different, and that genetic makeup is going to help determine the characteristics that that child has. So we know their sex, their race, their eye color, how tall they're going to be, how much they're going to weigh. All of those growth and developmental factors are going to be influenced by that genetic makeup. Each child is genetically programmed to be a certain height when they're fully mature. With what we consider adequate the adequate nutrition and good health, most children will attain the height that they are genetically programmed to have. There are some diseases, however, that can be genetically transmitted. And if these children do have a genetic predisposition to a certain disease, then we see that that child may not grow and develop as completely as that healthy child would. Of course, physical and mental disorders can also occur as a result of certain genetic factors within that child. The child's heredity also influences their personality characteristics, so their temperament. Their temperament is just a combination of all of the individual characteristics. So this is the way the child thinks, how they behave, and how they react to things that occur in their environment. We also know that the quality of that child's nutrition during the years when they're growing is going to have a huge effect on their overall health and their development, as well as the nutrition intake of the mother when she was pregnant with the fetus. That's also going to have a big role, a big influence on that child's growth and development. We know that nutrition has a huge role in that child's ability to be able to resist infection and diseases. And their motor skill development is also very influenced by inadequate as well as excessive food intake. So not just not taking in enough, but if they take in too much and they gain too much weight, then they can also have issues as well. Children will establish their nutritional habits and patterns very early in life. These patterns we know can follow them well into adulthood and can also influence their individual growth and development and health throughout life. And normal nutritional needs and daily requirements will vary at each stage of development. So that is also something to keep in mind. It is also no secret when we look at, there's many different aspects of a child's environment that are also going to affect their growth and development. So we can look at the family structures. When we look at family structures, we're talking about the family size. So how many children are in the family? What are the parent-child relationships? Any cultural background information? Socioeconomic level of that family can affect the child, especially if there's not a sufficient amount of money to be able to provide adequate nutrition, childcare, and then of course healthcare, also for the growing child. We see that growth and development is affected for children who live in a household where there are caregivers that are addicted to drugs or alcohol. This can also have a huge effect on the child. And then playtime and entertainment are also important environmental aspects in the development of the child. Some can be good, some can be bad, as well as homelessness, divorce, latchkey situations, which is where children at very young ages are forced to walk to and from school, and they are forced, there's not a parent home with them after school, so they're left by themselves, and then running away from home as well. So throughout these courses that we've taken over the last year, we have always talked about different theories of development. So we're going to talk about it once again. So we're going to talk a little bit about Erikson. So we know, remember back to when we talked about Erikson before, he describes human psychosocial development as basically a series of tasks or crises. According to Erikson, he believes that children, as they move through these processes, these series of tasks or crises, that they fall apart repeatedly, but then they grow together again. And if they're given time and sympathy and they're not interfered with, they will continue to grow and pull things back together again. He does believe that in each task, the person must master the central problem that they're dealing with before they can go on to that next issue or stage. So we know that some of the stages that he talks about, one is trust versus mistrust. This is where the infant learns that his or her needs are going to be met. There's autonomy versus doubt and shame. This is where the toddler learns to perform, tasks on their own independently. We also have initiative versus guilt. This is where the child develops a conscience and he starts to have a sense of right and wrong. There's industry versus inferiority. This is where the child competes with others and enjoys being able to accomplish tasks. And there's identity versus role confusion, where the adolescent goes through physical and emotional changes as he or she develops as an independent person with their own individualized goals and ideas. Then we have intimacy versus isolation. The young adult will then develop intimate relationships. We have generativity versus self-absorption, where the middle-aged adult is finding fulfillment in life. And then the last stage is ego integrity versus despair. And this is, of course, the older adult is going to be satisfied with life and the achievements that they have attained. And then we know, so Jean Piaget also brought very interesting insight and probably what we consider new insight into the cognitive development or the intellectual development of the child. So he took a good look at how the child learns and how they develop that contribute to their intelligence. So he described intellectual development as a series of 4 principal stages, and that each one of those stages was made up of several sub-stages. He believed that all children will move through these stages in the same order, but each moves at his or her own pace. So there's the sensoromotor phase, which is age 0 to 2. There's the pre-operational phase, which is age 2 to 7, the concrete operations phase, which is age 7 to 11, and then the formal operations phase, which was age 2 to 15. Then we have Kohlberg's theory, which was about the development of moral reasoning in children. So moral development does follow cognitive development because reasoning and abstract thinking are necessary in order for us to be able to make moral judgments. Kohlberg's theory is divided into 3 levels with 2 or 3 stages in that level, in each level. He believes that the child will progress from making decisions with no moral sensitivity to making decisions based on personal standards and values. So the first phase is the first level, is the pre-conventional or the pre-moral level. So this has 2 stages. In stage 1, we call this punishment and obedience orientation. This occurs between ages 2 to 3. The child determines right or wrong by the physical consequence of a particular act. This child simply obeys the person in power with no understanding of any type of underlying moral principle. In stage 2, which occurs at age 4 to 7, the child begins to view a specific act as right if it satisfies his or her needs. So children will follow the rules that benefit themselves. So the book that the example that your book gives is that they will think, I'll do something for you if you do something for me. But on the other hand, if you do something bad to me, I'll do something bad to you. So basically during this phase, the attitude is an eye for an eye. Then the second level is the conventional level. So in stage 3, this is what we call the good boy orientation. We see this between ages 7 to 10. And this is where being nice is very important. So children want to avoid a guilty conscience. So pleasing others is very important. In stage 4, we call this law and order orientation. This is between ages 10 to 12, where these children start showing respect to others. They obey the rules. And they maintain social order because that's the desired behaviors. Right is defined as something that finds favor with their family, with their teachers, with their friends. And then wrong can be symbolized in their life by broken relationships. Then we have the post-conventional or the principled level. So in stage 5, this is the social contract orientation. We see this between ages 3 to 18 years old. This is where those culturally accepted values start to define those personal standards and personal rights. A person's rights must not be violated for the welfare of the group. The end no longer justifies the means, and laws are for mutual good, cooperation, and development. And then stage 6 is personal principles. This stage is not attained very frequently. The person who reaches this level does what he or she thinks is right without regard for legal restrictions to the cost of themselves or the view of others. Because of this person's deep respect for life, he or she would not do anything that would intentionally harm himself, herself, or anyone else. So it is extremely important that as nurses, pediatric nurses, we have an understanding of all of the factors and influences, as well as what's normal or what expected patterns related to growth and development of the infant, the child, and the adolescent are. When we interview the child and the family caregiver, when we're providing care for the patient, we should have an understanding of the growth and development, because it's going to help us to be able to ask appropriate questions, and it's going to determine whether or not the child's development is within the normal range, or if there are any type of variations or abnormalities present. It's going to help us ask those age-related questions. When we should keep in mind that when we're talking to the child, we should always talk to them at his or her level. If they're 7 or 8 years old, we don't want to talk to them like they're 2 and vice versa. And then we want to make sure that because they're children, we're also teaching their caregivers, their parents, and we're working with those caregivers. And we should always be aware that the child's age and stage of growth and development can affect the way that the child is coping with the situation or the way they respond to treatment. All right, so the next couple of slides are going to cover growth and development. We're going to talk about the infant from 28 days old to 1 year. So we're going to start when we talk about Erickson's developmental tasks. So he believes that the development of trust will occur when that infant has a need and that need is met consistently. So every time, and a good example is when the baby cries, it's because they're hungry or they're wet and they need their diaper changed. And as that parent continuously feeds them when they're hungry, changes their diaper, meets their needs, then they start to develop that trust. The infant then feels very secure, of course, when their basic needs are met. And he does believe that this stage creates the foundation for all of the developmental tasks of the next stages to be met. So when we talk about physical development in the first year, this is going to be a time where this baby will, their height and their weight are going to increase rapidly. During the first 6 months of life, the infant's birth weight will double and their height is going to increase about 6 inches. Growth will start to slow down slightly during the second 6 months, but it is still rapid. By the age of 1, the infant has tripled his or her birth weight and has grown about 10 to 12 inches. At birth, the infant's head circumference usually averages about 13.7 inches and is usually slightly larger than the chest circumference. The head and the chest will grow rapidly, and after about the 5 to 7 month mark, the chest can be expected to start to exceed that head in circumference. Let's see. The posterior fontanelle is usually closed by the 2nd or the 3rd month of life. The anterior fontanelle will increase slightly in size during the first few months of life, but then after 6 months of age, it begins to decrease in size. We do expect it to close completely between the 12th and the 18th month. The sutures that are located between the cranial bones do not, however, ossify until later in childhood. We see that calcification of the primary or the deciduous teeth will start very early in fetal life. Shortly before birth, calcification is going to begin in those permanent teeth that are first to erupt in later childhood. The first deciduous teeth are usually the lower or the upper incisors, and we usually see them erupt usually between the ages of 6 to 8 months of old, age 6 to 8 months of age, but we also know that there are children who can, it can occur later, and it can also occur earlier than that time. We also know when we talk about their teeth, their family history, their nutritional status, as well as any illnesses that they've had, can certainly affect how soon their teeth will erupt. And then fluoride is recommended to strengthen the calcification of their teeth and to prevent further tooth decay. So I grabbed this from your book. This is the approximate age, just kind of a guideline that you can follow that shows when these teeth will erupt. You guys can look at that. I grabbed it right from your book. So when we talk about vital signs, so during the first year of life, we see a lot of different changes in the circulatory system. So when the mom was pregnant with the baby during the fetal life, in order for that fetus to have the adequate amount of oxygen, there needed to be higher levels of hemoglobin and red blood cells. But once that baby is born, we see that the respiratory system starts to supply that oxygen. So our hemoglobin levels will decrease, and those red blood cells also gradually decrease in number until that baby reaches about 3 months of age. After that, we start to see a gradual increase until the adult levels are going to be reached. So it's very hard to get accurate vital signs on a baby, especially when we talk about blood pressure. It can be very difficult to measure that in an infant. So sometimes we have to use an electronic or an ultrasonographic monitoring equipment. That makes it easier. The average blood pressure during the first year of life is going to be around 85/60, give or take. There's always some variations. In order to have an accurate count of the infant's heartbeat, we need to do an apical pulse count. So when we're listening with our stethoscope, we would take our pediatric stethoscope using the small diameter diaphragm, and we want to put it over that left side of the chest in the position where we know that that heartbeat can be heard clearly. Then we want to count the pulse for an entire minute. During the first year of life, we see that average apical rate can range from about 90 when they're asleep all the way up to 170 when they're awake. So 90 to 170 beats per minute. And we can even see that they can go as high as 190 when the infant is crying. Respirations will average around 30 per minute. As the infant starts to grow, we will see that their nerve cells will start to mature, their fine muscles will begin to coordinate in a more ordinary pattern of development. And we need to keep in mind that each child is going to follow their own unique pattern as to how quickly they develop. Between the ages of 6 and 7 months, most children will start to develop a fear of strangers. So people they don't see every day. Grandma comes in from Detroit. He hasn't seen her ever. He may not want to smile at her, and he may not want to go to her. As that infant matures enough to be able to recognize the mom or whoever the primary family caregiver is, that infant will start to become fearful when that person disappears and they can't see them anymore. To that infant, in their minds, out of sight means out of existence. They don't know that mom will come back in a couple of minutes. They don't know that they just stepped out of their room or they went to work for the day. So this is a very unsettling situation for an infant, and infants don't tolerate this very well. So they do say that the game peekaboo is very useful because it is affirming self-existence to that infant, and that even when temporarily, while they may be temporarily out of sight, that others still do exist. When we talk about nutrition, so the infant's nutritional requirements for their first 4 to 6 months of life are going to be supplied by either their breast milk or some type of commercial infant formula. Nutrients that may need to be supplemented, sometimes we see are vitamin D and C, also iron and fluoride. At about 4 to 6 months of age, we notice that the infant's iron supply becomes low, and some supplements of those iron-rich foods are needed. Around 7 to 8 months of age, the baby begins experimenting with finger foods and self-feeding. So sometimes you'll see that also around 4 to 6 months, it's hard for them to be fulfilled with just the bottle. So this is the time where we will start to add in oatmeals, baby foods, and things like that to supplement their nutrition. When we feed infants, it is very easy for them to push that food out of their mouth. So infants, the only way that they know to take in food is basically to thrust that tongue forward as if to suck, because that's what they've been doing since they've been born. They've been sucking on a bottle. So this is actually called the extrusion reflex, and it has the effect of when we give them solid food, they push it out of their mouth. So it does take them a little bit of time to get used to it, but it doesn't take them that much time. They learn quickly that their bellies get full and they're getting better food and they like it, so they learn quickly how to eat it. Usually when we introduce new foods to babies, we do it one at a time, usually a week at a time, or at least every 4 days, because we want to determine if the child has any type of allergic reaction. So we do kind of stagger those foods, new foods, over that 4 or 5 day period. And then when we think about the baby going from the bottle to a cup, this is usually a gradual progression that we see. They're usually weaned from that cup as they can tolerate. So usually around 10 months, I've seen children start to do this, but some people prefer to do it around a year. They like them to have that bottle up until they are a year old. It's just parent preference. So early in childhood, it is possible to see caries, which are cavities, another name for cavities. They used to be referred to as bottle mouth caries because when an infant is given a bottle at bedtime, they fall asleep. The sugar from the formula stays on the teeth and in the mouth, and it will cause an erosion, and it will break down that tooth enamel and cause cavities. So to prevent early childhood caries, it is recommended that a bottle of plain water or a pacifier for sucking should be given at bedtime, not any milk. If an infant is resistant to drinking milk from a cup, calcium and vitamin D those needs still need to be met. So if they don't want to drink the milk from a cup, then we can give them foods that are high in calcium and vitamin D. So yogurt, custard, cottage cheeses, things like that. We do know that our infants do get a lot of immunizations their first couple of years of life. So some of the ones that they're immunized against are hepatitis B, diphtheria, tetanus, pertussis, rotavirus, hemophilus influenza type B, polio, measles, mumps, rubella, varicella, which is chickenpox, pneumococcal disease, and meningococcal disease. They also can be immunized against the hepatitis A virus. These immunizations are usually given according to the American Academy of Pediatrics recommendation. These pediatricians should be following that schedule. These children, obviously, sometimes they get more than 1 or 2, sometimes they get 3 or 4 immunizations, needles per visit. So these babies definitely do need some cuddling and some comforting afterwards because it can be very traumatic. Some of the side effects that we see with the immunizations that they get, they can develop a low-grade fever for 24 to 48 hours after, always some tenderness around that site, redness, swelling at the injection site. These are all common side effects. We can give acetaminophen for fever. We can give cold compresses at that injection site to help with that pain. We should know that the child may be fussy. They might want to sleep a lot. They might eat less than usual because they just don't feel good. We should always encourage the child or the baby to drink fluids, hold them, cuddle them, and comfort them. And then, of course, there's a lot of family teaching that we should do for families with infants. Certainly we can't cover everything, but some of the key points that as the baby grows, we want to, for infants, we want to clean their gums and their teeth with a clean, damp cloth and plain water. Accident prevention is always something that we're going to be thinking about with the small babies and as they get into toddlers and they start to get on the move. So through different stages, we are always very closely watching the infant. We're monitoring their environment for any type of safety hazards. And we should always give some anticipatory guidance with regard to safety concerns. So you may notice at the pediatrician's office, as they start to sit up and as they start crawling, the pediatrician will say, you should have this. Do you have, corner guards on your end tables? Do you have your cabinets locked? Let's talk about this. So we're always kind of trying to anticipate what stage they're in and what kind of safety concerns are going on so that we can really educate the parents to help keep these babies safe. And that is it for principles of growth and development. If you have any questions, you can give me, you can email me, and then we will talk next week in person to see if you have any questions.